All right, we are moving into the second half of week 2, Integrative Approaches to Health Coaching. We're going to talk about exercise. This is really just a very general review of exercise. We're going to dive into, of course, in different lectures, specifics within different disease states. So today, let's just do a quick review, and I've got some resources and other information for you too. So, of course, looking at some statistics, we know that exercise is really important in reducing our risk for disease. Almost 50% of breast cancer we could reduce, mortality and the risk of reoccurrence. Almost 50% reduction in the incidence of high blood pressure, and 27% reduction in risk of having a stroke, and almost 50% reduction in the incidence of diabetes. And you can say right in the center there, this is Exercise as Medicine. That's where I got this graphic. And that's one of the resources that I'm posting for you. I love this resource. They've got a ton of stuff. It is really geared. They want physicians to start prescribing exercise because it's so important. And so there's, like I said, a plethora of resources for health professionals that you can have handouts for your clients or your patients. We see a 60% lower risk of colon cancer. Depression decreases as effective as medications or behavioral therapy. That's crazy. Now, I don't tell people just go ditch your medication. I absolutely want people to get involved in lifestyle practices, whether it's dietary or exercise or mind-body things, because they really, really can have a profound effect. But if medication is working for somebody and that's what they need, then that's great. I don't tell people just stop taking it. And some of these alternative things aren't enough for somebody. So we have to listen to the patient. We have to have empathy and value of where that person is and what their needs are. We see a 40% reduction in the risk of heart disease and a 1/3 reduction in the risk of developing Alzheimer's. And I love, we'll talk about Alzheimer's and cognitive problems, dementia, and how effective exercise is because it actually regrows the shrinking brain. A few other statistics, we see that we could save $2,250 per person per year compared to the cost of standard drug treatments. We have greater muscle strength, reducing the risk of mortality in adults by about 20%. In mild to moderate obesity, there's a lower risk of mortality compared to a lower fitness range. And we see, of course, improved learning. We see improved SAT scores in adolescents that have higher fitness levels, and we see that there's a decrease in violent incidences by about 59% in elementary schools when they get regular physical exercise, and reduced suspension. Variables are going to be connected, and I want to show that the exercise connection to all of these, at least briefly. So, of course, stress is connected to many of these variables, actually all of them. And we know, again, I'm showing just this bidirectional relationship, but there really is more going on. I just did this for simplicity's sake. So stress obviously can increase the risk of obesity. Obesity can increase the risk of stress, whether it's emotional stress or that internal stress. We see, of course, obesity can increase the risk of poor sleep if you think of things like sleep apnea. We see that poor sleep can increase the risk of disease, and we see disease can be connected to mood disorders. For example, cardiovascular disease is associated with depression. We see that mood disorders can increase the risk of addiction. And of course, addiction, if we have some kind of a substance abuse, whether it's alcohol or drugs, that can certainly have an effect on cognitive decline. Or even with certain conditions, it's not just because there's the damage necessarily to the brain, but because we might be missing out on nutrients that are needed for cognitive function. So there's a lot of different connections. And of course, stress and cognitive decline, if we start having cognitive decline, that can create some emotional stress as well. And we see again that many of these variables are either going to be directly or indirectly connected. And they are connected by things like oxidative stress and elevated cortisol levels, neurochemical imbalances. So those neurotransmitters like dopamine, serotonin, when those get out of balance, we have more mood disorders. We have even, if our sense of pleasure is lower, we might reach out to substances like food or alcohol or over shopping. We see hormonal and metabolic dysregulation that's involved in these. So for example, you think of diabetes or metabolic syndrome, where we have elevated metabolic dysregulation, elevated glucose levels, and hyperlipidemia, if you're thinking about metabolic syndrome. Well, when we start to have more of these, we start to have impact on our satiety signals, a decrease in satiety signals. But of course, these can start to affect things like mood disorders and what have you. We see some changes in growth factors like brain-derived neurotrophic factor, and we see elevated inflammation. And of course, all these variables in the yellow on the outside of this circle, these are connected as well. So they're connected to those variables in the red, burnt red, whatever that color is. And we know that exercise improves all of these. Exercise reduces stress, obesity, poor sleep is improved. We reduce the risk of disease. We reduce the risk of mood disorders. We reduce the risk of depression or addiction, especially if we're affecting all of those other variables that I mentioned. We can reduce cognitive decline. And it is through all of these physiological changes that we're doing this, through the oxidative stress, reducing cortisol, reducing or creating, I should say, balance between those neurochemicals and in the body and in the brain. Hormonal and metabolic regulation. We see increases in growth hormones, whether it's actual growth hormone or neurotrophic factors like BDNF, and we see reduced inflammation. So exercise improves all of these. It is so powerful. We have got to get people moving. So one of the ways that exercise is so beneficial to eating and to mood disorders is because it increases pleasure chemicals, dopamine, norepinephrine, endorphins, GABA, serotonin. Collectively, what does this mean? We feel happier, we feel more at peace, we feel more alert. It touches every aspect of our lives. We also see that exercise increases BDNF, that brain-derived neurotrophic factor. And of course, BDNF is like Miracle-Gro for the brain. And it allows those neurons to not only grow, neurogenesis, but it also allows them to connect. And remember, the connection is the key. We've got to have connection because the brain cell, the neuron by itself, can't do a heck of a lot. It's got to have community. Just like people, we've got to have community, we've got to have connection. So BDNF is a growth factor. It's associated with the neuron's survival and function. So not only do we need it to grow and connect, it's instrumental in the survival and function of our brain cells. And it's involved in that synaptic plasticity. So we talked about neuroplasticity. Synapse, remember the gap between the two neurons. So it's that connection between the neurons. So it's involved in them getting connected. It's also involved in mood, in learning, in cognition, and there is some research that's suggesting that it may also be involved in our drives to eat. So when we look at physical activity, of course, it's involved in self-regulation. And we talked about with mindfulness behaviors, those can be significantly impacting self-regulation. So this study, it showed that participants who exercise showed significant improvements in self-regulatory capacity. They found that the subjects decreased their perception of stress, and this is so key because it's not just the stress. Stress is necessary. It's our perception of the stress and how we deal with the stress that's important. But in this study, they found that exercise led to a reduction in perceived stress, reduction in emotional distress, smoking, alcohol, and caffeine. We saw an increase in healthy eating, emotional control, maintenance of household chores. Hasn't worked for me on that one so much because I still hate it. Attendance to commitment, monitoring spending, and improvements in study habits. So when we talked about self-regulation, I mentioned it's involved in any kind of behavior change. There is some self-regulatory aspect. So if we want to change behavior, we need self-regulation. And part of that self-regulation occurs with physical activity because exercise, like mindfulness practices, changes the structure and the function of the brain. We see that some of the same areas are involved in the changes that occur in exercise that we see with mindfulness. So I want you to start thinking about how if we have that multiple sandbag approach and we're using lots of different lifestyle therapies, we can have these maybe additive effects, maybe synergistic effects. But we get improvements from all of these, so they can work together. And so we see these same areas, the prefrontal cortex, the ACC, the limbic areas, and the insula being affected by exercise. So we improve attention control, emotional regulation, and that's huge, of course, when it comes to substance abuse, overeating. We need that emotional regulation because that's driving so much of those behaviors. And of course, we have more self-awareness. And when we're more aware and when we can be more in the present, we can better take care of our needs because we're aware of our needs. We start to recognize some of those subconscious behaviors and notice some of these things. So nearly every major personal and social problem has some degree of regulatory, some kind of regulatory factor. Now, like mindfulness practices and meditation, we see that exercise also has that effect, as I mentioned on the last slide too, the insula. And remember, the insula is that area of the brain that tends to be involved in more of that eudaimonia or eudaimonic well-being, that sense of purpose. So exercise is associated with an increase in insula gray matter volume. So it's increasing the gray matter in that region of the brain. And so when we increase this insula, of course, is involved in self-reflection, self-awareness, emotional control. And it's really important in us being able to set and pursue goals. So, of course, if our patients want to change health behaviors or anything for that matter, this is a good part of the brain to have bumped up. So the insula is associated with eudaimonia, well-being, as I mentioned, and this addresses, of course, those ideas of self-development, personal growth, flourishing, purpose, meaning in life. And those are very important in things like resilience and feeling hope and just having joy in life. And we see a negative association between the insula volume and depression. So when we want to think about mood disorders, which of course are going through the roof, exercise is going to help activate or increase the functionality and the size of these areas of the brain that are going to be really helpful in us reducing that risk and in helping with treatment. The problem is people aren't moving. People are sitting all flippin' day behind a computer and they're not taking the time to move. And over 50% of US adults fail to meet the physical activity recommendations of the minimum of 150 minutes of exercise per week. Over 30% of adults engage in no leisure time physical activity at all. And US adolescents and adults spend about 8 hours a day in sedentary behaviors. I've seen some studies that show that this number is actually higher. And that's really sad because we're sitting so much that even people that are exercising are still dying because they're sitting so much, even when they're making the US physical activity recommendation guidelines. They're still having heart attacks. They're still getting sick if they're sitting all day. We've got to get up and move more, not just regular physical exercise like jogging, but we need to just move more throughout the day. So let's dive into some of those recommendations. What is recommended? And I love this title of Listen to Your Ancient Genes. Listen to your ancient genes. We have survived, our species has survived by moving a lot. We did not survive by sitting around in a chair or a couch or behind a computer screen and driving for 10 hours a day. We survived with movement. And when you look at cultures that are still primarily hunter and gatherers, they move a lot and they're really healthy. They don't have the chronic diseases that we have. So the minimums are, as I mentioned, 150 minutes of that moderate exercise or about 75 minutes of vigorous activity per week. Some guidelines will say 60 minutes of vigorous, but most, like ACSM, will say about 75. And then some form of muscle strengthening. So that could be through resistance training, calisthenics, but we want to do that usually at least 2 days a week. Space it out, preferably, at least muscle groups space out every other day. And we want to target 8 to 10 different exercises, 8 to 12 repetitions. And that's for just general fitness. That's a very general guideline. And here's a more detailed recommendation table. I'm not going to go into all of this, but if you're interested, if you work for some different populations, you can see I've got some guidelines here for children, and they're pretty similar. I think, well, I might as well talk about it a little bit. The kids, really, you want to get them kind of playing more, at least getting out at least 60 minutes a day, doing some kind of moderate to vigorous exercise. And it's really a shame today because I know my kids, their school says no running. Yeah, no running. And they are really restricted in what they can do. They only have, now when they're at structured PE, they're allowed to run, but they only have PE a couple days a week. And they're at a public school, but I know friends of mine at private schools, some of them are kind of following the same suit, but it's such a shame, and they wonder why there's so many behavioral problems. It's because the kids are just sitting all day and they can't run. And then they have a choice. Do you want your snack or do you want to play? And they don't really have time a lot of times to really do both. So it's such a shame. And when we look at learning and test scores, I mentioned SATs, we are doing such a disservice, and we're taking away the time these kids have to play. By the time they get home from school, and if they have other activities, especially if those activities are sedentary, they're just not moving. And I think it's a really, really big problem. So I have some guidelines here also for pregnant individuals and or disabled. And down at the bottom, I've mentioned NEAT. NEAT is non-exercise activity thermogenesis, non-exercise. So this is movements like fidgeting. So if I'm like tapping my hand, oh, you can't see my hand. I'm tapping my hand, I'm tapping my feet at my desk. If I'm stretching gently, if I'm just very leisurely walking, nothing that's getting my heart rate up, I'm just kind of moving. This can be a significant part of our metabolism. And Dr. Jim Levine at the Mayo Clinic, which I've had the pleasure of working with on some projects at my last company, he's the one that really has done a lot of the research in this area, and it has an enormous impact on our health. And as I was mentioning, people are sitting so much of the day. His recommendation, ultimately, his optimal recommendation is to move for 5 minutes every 30 minutes. And I personally find that can be challenging. If you're in a work environment, you don't always have that opportunity to just get up every 30 minutes. But one of the things that I do is I set my alarm. I have a phone alarm, and I have my Fitbit, which has a vibrating alarm to remind me every hour that I need to move, I need to breathe, and preferably stand up and move around if I can. If not, I just tap my feet. A lot of times I might sit on a stability ball, a yoga ball, and I'll just bounce, which is fun. And or I just get up, I'll do some squats or some lunges, and I know that is more vigorous than it needs to be, but we just need to get movement. And if our clients aren't doing that, we need to try to figure out ways to get them to move. Even if it's for 2 minutes every 90 minutes, start where they're at and then gradually progress them to at least moving every hour. And again, optimally moving every 30 minutes if possible. But I have to say, if your alarm or your reminder goes off every 30 minutes, it's just Okay, just move and stretch something. Just to get moving a little bit is better than nothing. And of course, it improves productivity. There's so many benefits to it. Study that was looking at the effect of being a couch potato, sitting, whether it's at work or just whatever during the day. But what they're finding, again, is that people that may be actually getting that 150 minutes of regular exercise every week, moderate to vigorous, are still getting sick. And so what they're finding is that that sedentary time actually is associated with waist circumference increase and negative effects on glucose levels and triglycerides. But even getting just light, intense activity during the day was beneficial. It actually improved the waist circumference and the 2-hour plasma glucose levels. So just getting very light movement throughout the day, so getting that NEAT can have a really beneficial effect on physiological measures, of course, also psychological measures as well, and productivity. This is a website that you might want to check out. This is a video, actually. I've got the YouTube channel there at the top. And this Dr. Healy is the one that's done some of this research in this area. And you might want to check that out and check out some of her materials. So we need to get more PA, physical activity, throughout the day. And that can be accumulating activity. It could be that 10-minute bouts. Of course, even for exercise that gets the heart rate up, gets the breathing rate up. So we're meeting that 150 minutes per week. Just getting 10-minute bouts is perfect for that. You don't have to do it all at once, as many of you already know this, but you don't have to do it all at once. 10 to 15-minute bouts is 10 minutes being sort of a minimum if you're looking at that 150, but then adding in that NEAT activity in addition to that. And I mentioned earlier that I pair NEAT with other techniques. So I know that if I, at that hourly mark or half an hour mark, if I practice some of that deep diaphragmatic breathing, that deep belly breathing, which is going to activate that vagus nerve, activate that relaxation center, the parasympathetic side of the nervous system, that's going to help to keep me calm. It's going to help me to keep neurotransmitters in balance. So at 4 o'clock, when the rest of the world is breaking their diets, due to stress, I'm okay because I've stayed more balanced. And when I take that break, and I breathe and I move, I also check in with what I need in the moment, in the present moment. And when I get more needs met, I'm less likely to have the desire for the excessive behaviors. And that's what we need to get our clients to recognize, is that these simple techniques can have a really profound effect on their behaviors and their ability to stick with a program. So we see, again, we can pair it with, things that can help to reduce stress and improve self-efficacy. And we can add more pleasure to exercise. We know that research shows that getting outdoors, being in nature, can increase dopamine production. Music, it activates that ventral tegmental area, that pleasure center in the brain, and that releases dopamine. Social play, having social connection and engaging in activities that are fun is really important. When we have fun, we actually get stronger benefits in changes in the brain structure and function. So we want to do things that we're going to enjoy, obviously. We always tell people that because we want them to stick with it. But there's a lot of other benefits that are coming with actually voluntary exercise and enjoying the exercise. So if we start to incorporate some of these other things, then it can help our participants, our clients, to hopefully stick with something a little longer if they're getting some extra little dopamine bursts. So just like the fast food restaurants are doing with their commercials, they're pairing stuff off, right? They pair stuff together for a reason. We want to do the same thing. We want to take a balanced approach, of course, to physical activity, incorporating those health components of fitness. So that's aerobic activity, muscular strengthening, flexibility, addressing body composition, balance, agility, and really integrating the components of a structured physical exercise program. And that's that, think of that FIT principle: frequency, intensity, and time or duration. And applying principles of training like specificity, progressive overload, reversibility, and individual difference. Of course, including a warm-up and cool down, and then looking at those barriers that might get in the way of somebody engaging in a physical activity program or in NEAT. And I would address both of those separately. I'm going to talk about each of these different components just a little bit. I know those of you that are personal trainers or exercise physiologists, you obviously know all of this, but I'm just going to kind of jump into it just very briefly. So obviously we want to have a warm-up and a cool down. Really important, particularly for deconditioned individuals. And we don't want them to just jump right into, that max heart rate. We want to gradually warm people up, not only for the cardiovascular and respiratory systems, but the musculoskeletal system as well. Older individuals will want to take longer to warm up at a little lower intensity. So warming up before aerobic activity, any kind of movement that's getting that heart rate up, getting the blood flow increased and activating the muscles. This increases the speed of the nervous system impulses, and it increases the respiratory rate. So anywhere between 5 to 10 minutes, maybe a little longer, as I mentioned, for an older adult or somebody that's very deconditioned, and keeping that intensity low. And if somebody is overweight or quite overweight, then even the warm-up can feel challenging. So really keep it simple and low key. We can add some flexibility exercises after you do something that starts to get the heart rate up and warming up the muscles a little bit, and then do some light stretching. And like the warm-up, of course, the cool down is basically the same thing. It's just in reverse. We want to start to slow everything down. We want that heart rate to come down, that blood pressure to come down, respiration to come down, especially if you're working with somebody that's a cardiovascular patient. We really want to keep them moving, even if it's just a little bit, because even just that little bit of muscle pump, let's say the legs, even if you're just sort of bouncing your legs, kind of just going up on lifting your heels, then something like that, excuse me, can help to keep just enough pressure on the veins to keep that blood circulating, so you don't have the blood pooling in the extremities, which could lead to somebody passing out. So, of course, of particular importance are those cardiac patients. And a gradual cool down, of course, enhances that venous return, that blood back to the heart, and that reduces, like I mentioned, that blood pooling. And so a proper cool down also facilitates that dissipation of heat, and it helps to promote the removal of lactic acid. So that's going to aid in the helping to reduce muscle soreness as well. And of course, during the cool down, this is the best time to increase flexibility, when the muscles are really warm and pliable and can have more stretch. So aerobic activity, of course, aerobic activity is dynamic, it's rhythmic, things like running, jogging, swimming, anything that's getting that heart rate and respiration rate up for an extended period of time. And of course, aerobic activity has a couple of those components. We usually think in terms of an exercise prescription in general, just thinking about that FIT principle, that frequency, intensity, and type. Or duration, and we can prescribe to our clients in that way. And we want to kind of pay attention to this, because we want to gradually increase each one of those different components, that frequency, intensity, and the time. And we can do one at a time. A general rule is to increase no more than 10% per week, but you really need to pay attention to your clients and just see how comfortable they are. You just don't want to push too fast. I mean, you don't want them to stagnate, but I tell you, I've had so many patients and clients over the years that just want to jump in and do everything. And I have these men that are like, well, I played football in high school. And you're like, but you were 18 and now you're 60. And, we always have to really, again, it's sort of working and using that motivational interviewing type techniques to open it up to that ambivalence and everything, and make sure that people are being realistic with their expectations, obviously challenging them, but being realistic. And we know that for things like weight control, we might want to increase the amount of exercise that somebody's engaging in, the whole volume, whether that's through the increased duration or could be intensity depending on their level of fitness. We can increase intensity as well, but of course doing it very gradually. We're going to talk about obesity and exercise later. But, aerobic exercise should be increased up to maybe 300 minutes of moderate exercise per week, or vigorous exercise of 150. So we're going to gain a lot more benefits if we do that versus just sticking with the minimums of 150 minutes of moderate exercise a week. We also can incorporate high intensity interval training. I love HIIT training. It's a great thing to incorporate a couple days a week. It's phenomenal. It has a lot of the same physiological changes as doing aerobic exercise for about 45 to 60 minutes. So this is a huge time saver. For some people, they just hate it. So, you gotta work it in if you can. If not, then that's okay too. But I think for me, it's such a time saver, and especially when I had kids and I had such a little amount of time. I mean, if the kids were asleep, at the babies, when I have twins, when they were sleeping, I could do this. I could do laundry. I could exercise my 1 minute and then, or 30 seconds, and then I could go throw a load of laundry in for the 4-minute recovery bout. So I was able to really make this work for me and still get some physical activity that was really challenging for me to get with newborn twins. So you can see in this table, there's lots of different ways to do this. This could be, a lot of some of the interval training, if you've heard of Tabata type exercise, where they first started using cyclists and cycling intervals, and it was so effective. And now we see Tabata inspired types of exercise where you might use calisthenics between, for the different bouts of your exercise bout, and then have a recovery. Now, I said I did laundry, but usually you want to try to really actually recover. That's optimal. But again, here on the table, you can see a couple examples, like you could do 4 minutes on and then a 3-minute recovery, 4 minutes of high intensity. That's 90 to 95% of that max heart rate. I have an equation of 220 minus your age that will estimate that max heart rate. This is not a perfect equation. If you have a client that has had a treadmill test, you definitely want to use the treadmill test max heart rate versus this equation. Of course, if somebody is deconditioned, this intensity could be pretty harsh. So you really want to gradually build up to doing HIIT type trainings. And one of my favorites, which is more of the Tabata style, is that last one. And you do 8 bouts, 20 seconds on, all out, 10-second rest. I love this one. I've done this. As I've mentioned, I used to travel a lot, and I would just do the football drill. I just run in place as fast as I could for 20 seconds and then stop for 10 seconds. 20 seconds on, 10 seconds off. And that was a perfect way for me to, you could do jumping jacks, you could do other types of plyometrics that really get the heart rate up, but it's just so simple to just run, stop. So it's a great one. Now, for our patients, it's great to have them to learn how to take their heart rate. If you have clients that are on medications like beta blockers for blood pressure reduction, and other meds may have an effect on the heart rate. So for example, the beta blockers are going to blunt that heart rate response. So target heart rate isn't the best choice to use. I've had patients when I worked in cardiac rehab that had a trainer. This one person, she had a trainer, and the trainer kept pushing her. Your heart rate's not high enough. Like, it kept pushing her harder and harder and harder. And I'm like, oh my God, he is lucky you did not have a heart attack, because she was on her beta blockers, and she's a cardiac patient, You know, that was really unsafe for her to do, for that personal trainer to do that. He didn't know his client. He didn't know what she was taking, or he didn't know what the effects were, or he didn't know, you know, you got to assess. You have to know who your clients are and what their history is. So important, because you don't know. You know, everybody looks normal. I look pretty normal. I look pretty fit, but I got a whole heck of a lot of diseases. I mean, I've got epilepsy, I've got Hashimoto's, I've got, oh my God, what else do I have? I have IBS. I mean, I'm loaded with weird stuff, but I don't look sick. But, you know, so we need to know who our clients are. We need to know their history. Heart rate can be, of course, assessed with that target heart rate. We can calculate target heart rate ranges, but we can have people, as in the image, using the wrist. And you want to use the 2 fingers on the wrist. Let me see if I can get in the view. 2 fingers on the wrist, not the thumb. The thumb has a pulse of its own, so you're not going to get an accurate reading. And I always say it's kind of in that little dent right there between the bone and the tendons, and so you can kind of feel in that segment right there. Stronger pulse, of course, at the carotid, and just kind of sliding down from that ear and down that groove next to the Adam's apple, basically. And so you're going to get a stronger wrist. And then if you have patients that are cardiac patients, and some of them on medicines and what have you, or just older individuals, their pulse is really, really faint, and it's super hard for them. I mean, it may be hard. It's hard for a trained professional sometimes to find them versus, you know, a person that doesn't really know what they're doing. And so heart rate monitors, of course, are fantastic for this. But there are other techniques that we always use in conjunction with target heart rates. But before I talk about those, I have here a slide that shows estimating target heart rate range. You can look at moderate and vigorous. We always used to say low, moderate, or low, medium, and high. But a lot of times we just kind of go with moderate and vigorous, because those are usually the guidelines that we're talking about. So you can see that you can estimate that max heart rate, and then you take the percentage of that. So if the moderate range would be 50% to 70%, the vigorous range would be 70 to 85%. Of course, you can go higher than that if you're doing interval training. And so when we take the exercise heart rate, we're going to take that for about 10 seconds. And if you're doing a resting heart rate, I suggest that people do a resting heart rate in the morning and right when they wake up, unless they're startled, of course, because the heart rate's going to go up. So, and you do that for a full 60 seconds. So for a full minute, take the resting heart rate. It's a great gauge as to the cardiovascular system getting in better condition. As we get in better condition, the heart obviously becomes more efficient. It pumps out more blood per beat. That cardiac output increases, the stroke volume increases. So we become more efficient. And so that resting heart rate is going to go down because it doesn't have to work as hard. It doesn't have to beat as often to do the same thing. So this is a great way for your clients to assess you to assess for your client and see that they're improving their cardiorespiratory system, even when they don't get something like a treadmill test. The other system that is commonly used is the Borg perceived exertion. There's a couple scales. There's a 0 to 10, and then there's the 6 to 20. I've just always used the 6 to 20 working in different areas, cardiac rehab. We always use this one, but you could use, it really doesn't matter. Just use one and be consistent with it so that your clients are not confused. Like, wait a minute, I thought 10 was max exercise. So, you know, just kind of give them a whichever table you want and just have them assess how they feel. And so people that are on beta blockers or medications that blunt heart rate response, this is great. Or for those clients that just cannot get their heart rate and they don't have the money to buy a heart rate monitor, or they don't want to buy a heart rate monitor and they don't want a Fitbit, you know. So this is a fantastic tool. And what I love about it, and I would always, always, always use this, even if I use heart rate, because it gets people in touch with listening to their bodies. And that's what we want to do with emotions, with everything. We want to turn it to the body, listen. So intensity, if you're doing light exercise, that would fall, fairly light. Most of the time we say anywhere between an 11 to about a 15, so fairly light to hard. So if you've got patients or clients that are just getting started, they're really deconditioned, keep them on that low end, that blue zone, and then progress them up to that moderate area. Somewhat hard is a great place to be. That's a great place to be. And this is where most people want to end up. And of course, if you're doing some kind of HIIT training or interval training, up at that higher end. Now, I want to say something about interval training. I mentioned the high intensity interval training, that HIIT training, but there's also just interval training. And we actually used interval training with the cardiac patients in rehab because it helped to get them conditioned faster. So we would have them go to a certain level. We would monitor their ECGs so we could see if there were any irregularities. And sometimes we could map it based on that if it was predictable, or if they had a little angina, some chest pain, or shortness of breath. So we would really look at symptoms, but also we had their treadmill tests. So we know when things are going to be, and we would calculate all of their things based on that. But we would do the interval training so that they would, again, get stronger faster. So we would have them go so maybe it was just 30 seconds. Walk on the treadmill or ride a bike for 30 seconds. And that was enough. And then we'd have them rest. And then we'd have them get back up and do another 30 seconds and then rest. And so we would keep doing that for maybe about 20 minutes, 15 to 20 minutes, and then progress them to be able to do that consistently, because we know we want to get people to be able to exercise continuously, because that's functional. If you're going to go for if you're going to go to the mall, you need to be able to walk. And granted, they can find places to sit, but sometimes there aren't places to sit. So we really want to get people conditioned enough to where they can actually walk for a whole 20 minutes. Now, granted, if you are working primarily with 20-year-olds, this is not going to be an issue. The HIIT training is probably where you want to be. But the other thing that we help them to understand is, even regardless of these numbers of 11 to 12 and fairly light, somewhat hard, but really letting them kind of think about the words versus the number, but it's the talk test, and just getting them to understand, if you can sing, you're not really putting a lot of stress onto the cardiovascular system to make changes. If you can talk, you're probably okay. If your speech is a little bit broken, you're going to be in that moderate range. If you're so out of breath you can't talk, then you don't have to work that hard. And as you'll see as we progress through the class, when you look at things like depression, anxiety, stress, cognitive changes, reducing risk for Alzheimer's, moderate exercise is enough. We don't have to do the vigorous exercise. But remember, if you do moderate exercise, you want to engage in longer durations. And the more fit people get, the greater the effect we see in all of those things that I just mentioned. But so, can they sing? Can they talk, or are they out of breath? They want to be able to sing. Just kidding. No, maybe I shouldn't have done that, but you'll remember it now, right? So, muscle strengthening. Of course, we want to strengthen the muscular system, and muscular strengthening is providing that overload to the muscles, which is going to stimulate the muscle to become more fit. So this could be things like Pilates, having any external resistance. It could be calisthenics, could be plyometrics, could be traditional weight training with weights, or you could use bands, whatever it is. Anything that's going to overload the muscle, it's going to increase muscular strength and muscular endurance. You're going to be training more of those type 2 fibers versus the type 1 fibers that are going to be more primarily used in endurance or aerobic type of exercise. And when we talk about that FIT principle, that frequency, intensity, and type, so with this you can kind of use the same thing, but you're going to be thinking in terms of repetitions, the amount of weight that you're using, and so on. So of course, general guidelines, you want to use all of the major muscle groups, all the large muscle groups of the hips, the legs, the back, the chest, the abdomen, shoulders, the arms. And we want to work these, as I mentioned earlier, at least 2 days a week. We usually recommend, as I said, to alternate body parts. So if I work out my legs, maybe the next day I work out my arms. So maybe alternating upper and lower body, for example, or alternating chest with working back. So that way you allow one day of rest. That allows those muscle fibers to recuperate and restore, and then you can get more out of your workouts so that you're not overtraining. Typically 8 to 10 different exercises are needed to hit all those major muscle groups. Of course, if you're breaking that into, like I said, maybe lower body one day, upper body the next day, you don't have to do quite as many. And you can do anywhere between 1 to 3 sets of 8 to 12 different repetitions. That's typically what's recommended for general fitness. Of course, there's so many different ways to manipulate this, but this is a great place for people to start. And as people become accustomed to the load, they can increase the number of sets from, I always start at 1, always start at 8 repetitions, and then adjust it based on what the client needs. As that becomes easy, then maybe you go up to 10 repetitions, then 12 repetitions. Once that's easy, then increase the amount of weight. You might think of approximately a 5% increase in weight, and then drop the repetitions back down, and then again, beef up the number of repetitions. Once you get to about 12, increase the weight, drop it back down to 8. And you could do, as I mentioned, anywhere between 1 to 3 sets. Usually you can get a lot of great gains with just 1 set. So some of it will come with how much time does the person have. I know a lot of times I just want to do 1 set and I do full body and I'm done, because that's what I have time for, and I'm just going to basically do 1 exercise for all the major groups. Another way to think about this is to do the multiple joints. So major muscle groups oftentimes they use 2 joints. So if I'm doing a bench press or a push-up, I'm using both my shoulder joint and my elbow joint. So I'm using multiple joints. If I'm using multiple joints, I'm hitting lots of different muscle groups. So that's a more efficient way if you don't have a lot of time. And also, it's helpful. I mean, again, there's a lot of ways to train, but just generally, if I burn out my triceps before I do my bench press, well, my chest is stronger than my triceps. It can handle more load than my triceps can. Well, now my triceps are already fatigued, so now when I go to do my bench press, I'm not going to get as much out of that. Now, I could do some other exercises that are single joint like flies, but you get my point. If you do the small muscle before the big multi-joint exercise, so single joint versus multi-joint, then you may not be as efficient. So just with some resistance training guidelines, slow and controlled is typically the way to go, especially for older individuals. I know things like CrossFit can go a little bit faster. You just have to be really cautious with fast movements because the risk of injury is so much higher. But also, if you're using momentum to go through your movement, then you're actually going to use fewer muscle fibers to do that work. And we want to maximize not only injury prevention, but also we want to use as many of those muscle fibers as we can. We don't want momentum to do the work for us. We want to do the work for us. And in a general rule, we're going to do about 1 to 2 seconds up, 3 to 4 seconds down, so a little bit slower on that eccentric motion. So concentric when we're doing the contraction, eccentric on that resisting the pull of gravity. The other thing that's really important, especially for cardiac patients or people with high blood pressure, is that Valsalva maneuver. We need to make sure people are breathing. They need to never hold their breath while they're exercising, because we end up causing the blood pressure to shoot up really fast and then it drops. So we want to try to prevent that, of course. Like I said, especially for people that have blood pressure issues. Sometimes people just can't remember, oh, you should inhale on this part and exhale on that part. Just breathe. For some people, it's just breathe. So if they count their repetitions, they're not holding their breath. So just little things like that we need to instill in them, but just no breath holding. Here is just a very basic table. This is a sample resistance training table. I'm not going to go into all of this. You can look at it. If you already do training, obviously this is a very simple, just straightforward program, but hitting all those major muscle groups. The other thing that you can think of is sort of push and pull. You always want to have a pushing exercise, and sometimes you might alternate a push exercise followed by a pulling exercise, and then hip thrusting like a squat and so on. But you can alternate some of those, so that way that's just a simple way to stagger the exercises. And let's move on. Bone strengthening, of course, if you're doing any kind of resistance training, that's going to be strengthening the bones. There are weighted vests and things when people have issues with osteoporosis or they need to load the spine. Sometimes they might wear a weighted vest. Obviously, you have to make sure you're not doing something that's too heavy that could hurt somebody. But just increasing that load is great. That's one of the things with walking or jogging versus cycling is you can load the legs and the spine a little bit more. But any time of exercise, of course, is going to be important. But the bone strengthening exercises, of course, can be with lots of different types of exercise. And balance training. This is great for everybody, but it's especially It's especially important for people as they age because we start to lose our balance. I've noticed myself, it's so interesting how my balance has changed over the years. I was a gymnast, so I've always had really, really good balance. And I still have good balance, but I mean, it's not as good as, it's not even close to what it used to be. I mean, I wouldn't expect it to be. I'm not a gymnast anymore. I haven't been for like a million years. But I do yoga, and I've just noticed how off my balance is sometimes, and it's just, I think, part of aging, or when I'm going downstairs, I definitely notice a difference. I love when I see people in the park doing the tightrope. I have never tried it. I maybe would have tried it when I was younger, but that seems really hard. But I love seeing people do it. Some simple things that we can do with patients is just have them stand on one foot. Just stand on one foot. I mean, yoga is great because there's so many poses that work on balance. But stand on one foot, and they could hold on to a chair, have some kind of, have something or a wall where they can stabilize themselves, but then just gradually take the hand off and work on balancing on one foot. Eventually, maybe closing the eyes for a little bit because that takes a lot more balance. And so you kind of take out that visual proprioceptive piece, and you just have to feel with the body versus the visual system. But there's lots of different things you can do: heel walking, toe walking, backwards walking, sideways walking, all kinds of things, and practicing those things regularly. I love stability balls, and of course there's lots of different devices and BOSUs and all kinds of things that we can use to train for balance and for stability. But the stability balls are so great. They allow us, when we sit on them, because they rock and move, we have to use so many more small muscle groups within the trunk to stabilize. That's one of the reasons they're great for having at a work desk instead of a chair. They keep us moving. They can be fun. You can bounce on them, like I said, set your timer and bounce for a little while. But they're great. There's obviously 3 million exercises that you can do with stability balls, and they're just phenomenal, and they're great at helping us to increase our balance. Here's just a little table that I wanted to show for those of you that might not use these often. Here's a guide to the size of the ball that somebody needs. And if somebody's just getting started, you might want to use a ball that is a little less firm, and that way they can start to learn how to get balance on it. Because initially, if you've ever seen somebody sit on a stability ball that's never been on a stability ball, particularly deconditioned or older patients, they just fall right off. There's some that are almost like a peanut shape, and sometimes people can get started on those first. Before the round stability ball. But again, you have to have balance to be able to sit on the ball. So not only to do the exercises, but just to sit there. The other thing, when you're looking at the size of the ball, you want to have about a 90-degree angle at the knee and the hip. And What else? If somebody's a little bit larger, they might need, if they're heavy, they might need a little bit larger ball. But other than that, you just want to, if you know, you just kind of get one that allows you to have that 90-degree angle. Flexibility is also one of those components of exercise. And of course, we want to focus on flexibility primarily when the muscles are really, really warm. After exercise is the best time when the muscles are more pliable. For most people, now certainly with certain sports, you might do some ballistic stretching, which is that bouncing stretching. There's other types of stretching like proprioceptive neuromuscular facilitation or PNF. And those are some examples, but usually we recommend static stretching. Static stretching is where you're holding that stretch, like the guy in the picture, although he's static because he's in a picture. But you want to do a static stretch, hold that stretch for about 10 to 30 seconds is appropriate. And usually we'll have people repeat best, I mean, really for best results to do, repeat the stretches about 4 times. A lot of times people don't have time to spend going through all 4 repetitions of each stretch, but I try to do at least 2, and getting all those major muscle groups is important. What else? Going through that full range of motion is helpful, of course. Some people won't have that. If they're inflexible, we want to work on that, or if they've had injuries, we have to be cognizant of any injuries. If you can get any notes from physical therapists, that's helpful as well. So here's just a little sample exercise program, and we're looking at doing some kind of that aerobic exercise, resistance, flexibility, warm up and cool down, and that APHR is just for age predicted max heart rate, and ROM for range of motion, RM for repetition maximum, and repetitions, reps. So again, just a very general sample where somebody might get started. The last, I think this one is the last component. I think I've talked about the others, but body composition is, of course, something that we want to focus on with our clients. It's that percent body fat that we really want to target. That's what's great about exercise. Not only does it target fat, of course, and increasing lean tissue. So, of course, our lean tissue, our fat-free mass, is everything that's not fat mass. So it would be the fat-free masses, the muscle, bones, water, everything else that's not fat mass. And physical activity, in addition to dietary intake, is going to be important in weight loss and weight maintenance. Now, diet is going to be more important for losing weight. We really have to watch the diet more closely for weight loss, but these work together, and we'll talk about why exercise is so valuable to weight loss, not just because it's burning calories and increasing lean tissue, which increases our metabolism, but the way it affects the brain and the satiety hormones is really important. And of course, research shows that people that exercise maintain their weight loss more effectively than people that don't. And when we exercise and have caloric restriction alone ends up leading to a reduction in lean tissue, so our metabolic rate goes down. The physical activity is going to help counter that so that we keep our metabolism up. And of course, it burns calories and helps to tone the muscles so that they look, tone and fit. So some of the I guess the extra pluses on the side of being healthy. So principles of training. So we've talked about the components of training. Now we're going to talk about the principles of training, which are specificity, overload, reversibility, and individual difference. So specificity, or being specific, I should have written specificity on there. That is basically when you think about what the goals are. If you want to run a 5K, then riding a bike every day instead of running isn't specific. Now you're going to improve your heart and lung function. You're going to get that cardiorespiratory system in better condition, which is absolutely going to help you to be able to run. But it would be better to use the legs in the way that they're going to be used for whatever the goal is. So if the goal is to run a 5K or a 10K, then you want the muscles to be strengthened in that way, and you'll utilize slightly different muscle fibers for those different activities. So again, this is just an example of being specific. Progressive overload. is that you don't want to just do the same thing all the time. We've got to mix things up a little bit. We want to have overload. I mentioned with the aerobic training to use that 10% rule, maybe increase by about 10%, either the duration, intensity, or, well, I guess that would be it, not the time. Yeah, time is duration. Okay, all right. Maybe I should take a break. My brain is starting to get jumbled. So, or with the resistance training, just as a rule of thumb, once you bump up those repetitions, remember that 8 to 12 repetition range, you get to 12, then increase the weight by about 5%. Again, you got to play with the numbers, but you want to have this overload so that you continue to stimulate the muscles and continue to have growth and change. If we quit, we reverse back. I mean, we can have in some of the enzymes that change, the mitochondria, again, the powerhouse energy production, those will change very rapidly when we stop exercising. So a lot of the strength gains and improvements that we make are going to reverse. Even within a couple weeks, we start to see some significant changes. Individual difference, of course, everybody's different. And based on their genetics, based on their likes, their dislikes, and all of that, everybody's going to be a little bit different in how they respond. Not everybody responds the same way, obviously, and we have to kind of acknowledge that as well. And we don't want to overdo it. I love this image. Overtraining just defeats us. It absolutely defeats us. If we're doing too much too soon or too much for too long, it ruins our motivation. It increases poor mental state, more bad moods, more irritability, we see more depression, and especially in patients that have mood disorders, we absolutely don't want to overtrain. We don't want to push too hard too soon or too long. So we increase fatigue, we increase stress, physiological as well as emotional stress. So overtraining does nothing for us. Doing too much too soon does nothing for us, and we need our clients to understand that. I say that again because I've had so many people that want to push too much too soon, and they don't take enough breaks when they need to take breaks. That's why we say usually have a day off, have a rest day. It's really important. And the other thing, I was going to say one more thing with the overtraining is that you can use that heart rate. As I mentioned earlier, we can monitor that resting heart rate in the morning for a full minute, and we can see if that's going down, the cardiorespiratory system is improving. Well, if you start to see that resting heart rate climbing and it's sort of steadily going up, then that gives us a clue that we may have some overtraining occurring. We want to pay attention to that. We're going to kind of switch gears a little bit here and talk about basically assessing a client and looking at referrals. So first of all, we want to assess them, know their history, know if they're safe to exercise, look at the readiness to change that trans-theoretical model, prescribe exercise. Based on that, we could do fitness assessments or use measures that have already been done by maybe a medical group, like I said, a treadmill test, for example, and then knowing when to refer. If we have a patient that has musculoskeletal issues or disease state, cardiovascular disease that's significant, they haven't gone through cardiac rehab, maybe that's a person we want to refer out if that's outside of our scope of practice. So we want to look at where do we find good trainers. Obviously, UCLA has a fantastic certification program, and we have some really well-trained people that go through that. But we'll talk about some of this too. So one of the first things we want to do is a PARQ, and this is just that physical activity readiness questionnaire. It's really simple to use. It's just a few questions, and it'll get you enough information to know if you need to refer this patient out to get medical clearance. So has the doctor ever said that you have heart condition or should only do physical activity recommended by your doctor? Basically, if they have any risk factors like chest pain, shortness of breath, if they have problems with feeling dizzy, if they've lost consciousness before, fainted, if they have any joint or musculoskeletal problems that can be limiting, and if the doctor has currently prescribed any medications like blood pressure or heart medicines. And the last one is, do you know any other reason why you should not be physically active? So this is just really short. If they answer yes to any of these, you want to get clearance from the physician. And here is a risk factor screening sheet also, so we can start to just do a quick check. What I like about these is you get this a total score, and so most of these are going to be a plus except for HDL. That's going to be subtracted from the score. The higher the score or the more risk factors. That's because these are risk factors. So age, anybody over 45 for a male, 55 for a female. If they have any family history, that's immediate family. And that would be, you know, heart attack, heart surgery, sudden death of again, an immediate relative, smoking, current smoker, or they quit in about 6 months, within the last 6 months, or exposure to environmental smoke, sedentary, less than 3 days per week for over 3 months. And this is such a great one because, again, you'll have so many patients or clients that haven't exercised for months or years, but they'll talk about and they don't realize how long it's actually been and how deconditioned they might be. Body mass index, if they have a waist circumference for a male over 40, for a female over 35. Hypertension, and that would be 140 over 90 and or. High cholesterol, so if their their LDL is over 130, if their HDL is low, less than 40, or they're taking medication for cholesterol. So typically people are going to be on a statin for cholesterol. If they have an elevated blood sugar, it doesn't have to be diabetes, but of course, if they're diabetic, their blood sugars, you know, that would be a risk factor, but over 100 milligrams per deciliter. If their HDL is above 60, then you would subtract that risk factor. So we have an example. If we had a 56-year-old female with a blood glucose that was over 100, that's 2 risk factors right there, 2 risk factors, age plus the glucose. So ACSM and Exercise is Medicine and other organizations basically use similar criteria. So you can rank people based on those risk factors as low, moderate, or high. If they're under 45 for a male, under 55 for a female, and they have less than 1 risk factor, then they're low risk. Moderate would be based on age, over 45 and 55, and or if they have 2 risk factors. Again, just the age plus a risk factor would be 2 risk factors. And then if they have high cardiovascular disease, if they have known cardiovascular disease or other diseases like diabetes, if they have symptoms of disease like shortness of breath or chest pain, those types of things, that would be possibly disease. So we would want to get that checked out first. And then you can look at the low risk group. They're fine to start exercising either at a moderate level or at a vigorous level. If they have if they're in that moderate category, moderate exercise, low exercise, of course, is fine. But it's best to get a recommendation or, you know, make sure they're cleared by the physician, says they're okay. If they're high risk, they need a clearance before doing any kind of exercise. This is a nice chart. It's a lot. I won't go into all of this. This is from Exercise is Medicine, and you can see the website below where I got this, but it's just a lot more detailed. So if you like more detailed flow charts, kind of like I do, you'll love this one. But it's basically saying exactly the same thing as the last table, just with a lot more detail and making recommendations. And they include a couple other things like renal disease and what have you. So there's just obviously a lot more detail in this one. So this is just the information that goes along with that table so that you know what the little pluses are and all that jazz. Now, when to make referrals. Obviously, if your client is saying yes on that Part Q, you want to refer them to the physician to get clearance, or if they have any risk, you know, multiple risk factors. But the other thing is, when you don't feel comfortable prescribing exercise, maybe you're a psychologist or you're a dietitian, maybe you don't feel comfortable with exercise prescription, it's really out of your scope. Well, you want to be able to refer to quality people. I mentioned, obviously, UCLA has a fantastic health fitness instructor program certification, but you want somebody that has a certification, and there are a number of really good ones. I've got a lot of information on different organizations that provide certifications. American College of Sports Medicine, of course, is a top tier. The National Strength and Conditioning Association, and there's a couple others that are really, really good. But if you can find somebody that has a 4-year degree and a credential, that's fantastic. But there are amazing people that don't have a 4-year degree, and they're phenomenal trainers. So I think you just have to do some of your homework. You know, how long have they been training? What is the certification? Where is it from? American Council on Exercise is another really good one, but it's I wouldn't put it up as high as, of course, like an ACSM, American College of Sports Medicine. And obviously, I've mentioned the Exercises Medicine also has certifications as well. And so you want to make sure that the person is CPR certified, not necessarily first aid, but at least CPR. They should have some kind of liability insurance. You want to find out if they work with any special populations. If you've got a patient or client that has some kind of a risk factor, a disease state, then you want to try to find out, find somebody that's worked with that population. Do they conduct fitness assessments? Maybe that's all you need, is you just need somebody that can do some fitness assessments, and then you can track and do most of the work yourself. So you just want to start looking around. There's some great gyms out there. Equinox is fantastic. I mean, there's so many good places, but you just have to do a little homework, and that can be part of your assignments. It really is to learn how to network and find those resources so that you can refer patients and really create that network. We talked about that comprehensive approach. It's not just having, comprehensive looking at diet, exercise, and mind-body therapies, but it's also a comprehensive approach with people that you're working with and having that network. So, maybe a psychologist, a physician, a personal trainer, a dietitian, and people working together. There's a program, gosh, I can't think of the name, Retrofit. And I don't know if it's still around, but it was one that I had evaluated for a project several years ago. And what I loved about this was that they had nutritionists, they had either a therapist or somebody that had a degree or was trained in counseling, and they had an exercise physiologist. And they had all three, so it was an online program, but you would meet with each person. You met with the dietitian more because that was more of a weight loss program, so they would have their people meet with the dietitian more often. But that was a really cool program because they really were looking at all these different aspects that are so important. So it was, again, a comprehensive team approach as well. This is kind of a nice little very brief assessment, and I believe I got this one from the Exercises Medicine, but this is a physical activity vital signs, and it's something that's really fast, that really for a physician that has little time. And that's another thing I want to say. I'm going to jump in with another thought, was physicians are so pressed for time, and they are not referring patients. They don't talk to patients about exercise. A lot of them don't feel comfortable talking to patients. They really need some help with this. And so this is something that physicians can use that's really fast. Basically, it's just on average, how many days a week do you engage in moderate to strenuous exercise? On average, how many minutes do you engage in exercise at this level? So you're looking at the number of days, the number of minutes, and then you come up with a total. So total minutes per week of physical activity, you're just multiplying number one by number two. And then you can make some assessments on what the patient or the client is getting at this time. How many days a week do you perform muscle strength exercise? So we're looking at that resistance training. So the overall amount of exercise and the type of exercise. Another assessment that I have used is the IPAC. This is the International Physical Activity Questionnaire. So some of the assignments you're going to do in this class, you're going to actually be basically building a booklet of what you're going to do with clients. And you can curtail it in many different ways, but part of it is assessment. So you want to be able to have a really good assessment. You can mix and match. You can use things that are already made, or you could create something yourself. But this is one of the questionnaires. It's not that long, but it does use METs, which we'll talk about in just a bit. So if you're not really comfortable with METs, then this one might not be the assessment for you. just like that vital signs, just find out what they're doing. That one's the super simple, super fast one. But in this questionnaire, and this is a validated questionnaire, they examine how many days a week that you're doing vigorous exercise. So in the last week, in the last 7 days, how many days did you engage in vigorous physical activity, such as heavy lifting, aerobics, fast bicycling? If you were unable to engage in physical activity, please indicate how many days you typically engage in physical activity. So the next question is, how much time did you usually spend doing vigorous physical activity on one or more of those days? Then you ask about moderate, same exact type of question, just moderate level of exercise versus vigorous. So you're gauging how much they're engaging in vigorous or moderate exercise. Then you are going to look in the last 7 days, how many days did you walk? So you're actually looking at a little lower level, but how many days did you walk for at least 10 minutes? Remember, 10 minutes is a really good cutoff point if we're looking at that guideline of at least 150 minutes of physical activity. 10-minute bouts are really the minimum that we recommend. Getting the heart rate up, getting the respiration up. And then of those days, how much time did you spend walking? And then we create a calculation based on that information. And again, this is using METs. So if you're not familiar with METs, this is not difficult, but it's just, it may not be, it may be more than you want to use. We use this more, I use METs in cardiac rehab, but in other settings, I usually just keep it really simple. So METs, basically, this is a metabolic equivalent. That's what it stands for. And metabolic equivalents basically represent exercise intensity, but it's based on oxygen. And so if you're looking at one MET is the amount of oxygen that's used per unit body weight, and that's for 1 minute, and it's at rest. So a resting state would be 3.5 milliliters of oxygen per kilogram per body, kilogram body weight per minute. That's what a MET is. That's a resting MET. Now, so we have all this exercise that's based on intensity, like how many METs of exercise. And I think I have a table for you that I put into this lecture. But if I didn't put it in this one, it's in another one. So here's a sample based on the IPAC questioning. We have the MET level. This person is walking. The MET level for walking is pretty low. So this one lists, and then we have moderate exercise and then vigorous exercise. So the metabolic minutes per week for 30 minutes per day, 5 days a week. And so we can calculate out the total number of MET minutes based on each one of these levels of exercise. So the total MET minutes for the week, it's just the walking plus the moderate plus the vigorous. And so we can set goals based on the metabolic equivalents. So if somebody's in the category of low, they're not doing exercise, some exercise is reported, but it's not enough to meet categories 2 or 3. So if they're getting enough moderate, and of course this is what we want. We want people to be getting moderate or high intensity exercise and to meet those basic guidelines. So either of the following will hit the mark for moderate: 3 days a week of vigorous exercise for at least 20 minutes, 5 days a week of moderate exercise or walking at least 30 minutes, or 5 days a week of any combination of walking, moderate, or vigorous intensity activity. Somebody that falls into the high category would be any of these two, either one of these. One is vigorous activity, and that would be at least 3 days a week or accumulating at least 1,500 MET minutes per week, or exercising 7 days or more. I guess it wouldn't be more, 7 days or more days. It's really 7 days or combination of walking, moderate, or vigorous. Great. I actually put the table in this one. I thought I did. But here's just a table if you're interested. This is just for your information of the categories of low, moderate, and high. Here I just have an example of if you had somebody that was doing a moderate level versus a higher intensity exercise to get the same level of MET minutes. So if somebody was doing a 4 MET activity, so pretty, very, a moderate, but on the low end of moderate, and they did that for 30 minutes, you would multiply the METs times the minutes. So 4 METs times 30 minutes would give you 120 MET minutes, or that would be 2 MET hours. And if you looked at somebody that would get the same 120 MET minutes, but doing vigorous exercise, they would only have to do 15 minutes of exercise if the MET level was at 8. So calculating METs, find the MET value for the individual's activity, and then you can calculate the activity times the minutes spent. So this is just exactly what we did on that last example. But what I really want you to see on the slide is the actual weekly MET minutes can be summed and evaluated. So that's the positive of this, is it allows us to evaluate and progress and make sure we can say, okay, this is where this client is, here's where I want them to be, start making, setting some goals. So low or no reported physical activities, less than 600 MET minutes. So we want them to be obviously a lot higher than that. We want to get people moving. So moderate would be anywhere between 600 to 14, almost 1500. High would be 1500 MET minutes per week. This is just a simple flow chart looking at risk based on that PAR-Q form, if we had high risk versus low risk, and looking at the pathway if we needed physician approval. If we get that physician approval or they're low risk, we want to prescribe for formal exercise as well as NEAT, that non-exercise activity thermogenesis. So if they're sitting, and I'm going to go to NEAT, if they're just sitting and they're not doing any kind of movement most of the day, then we need to just start with getting them moving anywhere between 2 to 5 minutes every 90 minutes. If they're getting moderate amounts, 5 minutes every 60 minutes, high amounts would be 5 minutes every 30 minutes. So we want to try to progress people to that. Now, below there, we have the formal exercise, and this would be using those MET minutes. If they're not getting much, we want to start, if they're getting that low end, they're getting somewhere between the 3 to 6 METs of activity. They're only getting about 600 MET minutes per week. We want to start bumping them up from there. But again, this is something that we can see where they're at and progress them. And this is just a sample of a workout at a 600 MET minute level and goal. A little time talking about some of the obstacles, some of the common obstacles that get in the way of people being successful. One of the issues that we have, one of the obstacles really is that ambivalence that we've been talking about. And we can use the pros and the cons, the benefits or the costs of staying the same or changing. So I love to have clients use just the simple table and fill it out. What's the benefit of staying the way you are? What's the benefit of changing and starting to exercise regularly? And you could do this for different types of exercise and all kinds of things, but this is a great way to start moving them, kind of to see the discrepancy between their current behavior and where they want to be, and then moving them through that state of contemplation really to that next phase. One of the biggest reasons that people don't exercise is because they feel like they don't have enough time. And I'm going to emphasize that. Feel like or think they don't have enough time. Because oftentimes we can squeeze it in different places if we are crafty. So this is a nice little table that you could use something similar and just really have the client map out what they do during the day. And look at different areas that they could either cut back on or eliminate altogether. So this person gets up at 5 in the morning. I used to get up at 4. God, that sounds painful. They watch TV, they drink some coffee, then at 6 to 7, reading the newspaper, driving to work from, between 8 to 9 up until about 4 o'clock, drive home, watch TV, check emails, have dinner, relax, watch TV. So you can find areas that are not heavy value for them. You can weight some of these things and find opportunities to do those 10-minute, maybe 15-minute segments of exercise. So if I don't think TV and, drinking, or maybe let's say that TV and drinking that coffee in the morning is like, I got to do that. That's super important to me. Then I'm going to leave that. Well, maybe reading the newspaper. Does anybody read the newspaper anymore? I don't know. But, maybe that's not a huge priority. Or maybe instead of doing that for an hour, I can cut 15 minutes out of that time. And then maybe when I get home, then I do a 15-minute walk. Or maybe I know that when I'm home, I'm tired, I'm not going to do it. So maybe I really do need to schedule a little bit more time during the morning. And then what about lunch? Can I cut my lunch down by even just 15 minutes, take a 45-minute lunch, and then go for a walk maybe right before I eat or something? So we want to find those areas that are high value and look for opportunities to add in those short segments of exercise. And finding the time, what would you do? I love this. If offered $100,000 to incorporate 4 exercise sessions into your busy week, what would you do? How would you do it? Would you do it? And I think anybody would say they would find the time really fast for $100,000. So find those opportunities. If we rephrase and reframe, I'd find the time. I would dump that newspaper and I would dump that coffee really, really fast. So, again, prioritizing. I wanted to present this with you because one of the issues, of course, with time, sometimes people don't have time to go to a health club. These are just some online sources. This is a bar method, yoga, Pilates. There are a lot of online studios now, and some of them are really, really reputable studios, and you get top-notch instructors, and it's a fairly, reasonable fee for a lot of these. So I've tried, which one did I do? I've done a yoga one when I traveled a lot. I used to do, and I've also used, what was it? There's one that it's not up here that I used to use when I traveled a lot. Gaiam. I think it was Gaiam. And the only issue, sometimes I'd have problems with connectivity every now and then. But these are great when you're at home and you don't have time to go to a studio, or you can only do 20-minute sessions or 30-minute sessions, and all the studios are an hour and 15 minutes. These can be a really, really great option for people. Another area that I want to talk about is self-efficacy, because this is so important. There is a validated questionnaire on exercise self-efficacy. I also have a validated questionnaire on not nutrition, but diet self-efficacy that you might want to use to assess your clients and kind of think about some of the questions that are in these, or using these all together in your one of your assignments when you're creating your book. So, of course, self-efficacy is considered very important for people to move through the upper stages of change, moving from contemplation to preparation, or from preparation to action. Self-efficacy, very important. We've got to help people set themselves up for success. And as a coach, we also support the patient or the client's belief in his ability. We really want to help facilitate that to change. And one of these ways is to present the client with examples of positive change. Another is to emphasize the importance of taking responsibility. We got to have some limits. We need to nurture, but we've got to set limits also. And finally, you can have your client, they should feel a strong sense of support, a positive rapport with you, of course, as the coach, but also with others, and find that social network. And we can work with them to find that social network of people that they think can really support them in their efforts and further their sense of self-efficacy. And so it's especially useful during the preparation, action, and even the maintenance stage. And also even later when we want to try to prevent relapse. We're going to talk a lot more about self-compassion in another talk, but I wanted to bring it up now because self-compassion, the research shows that people that are self-critics actually have lower self-efficacy. And of course, self-efficacy being so important in our ability to create health change. So when we are when we have self-criticism, we tend to have more anxious feelings. People tend to have more depression. And self-criticism, it really undermines our motivation. It undermines our motivation and it reduces our potential to be successful. So self-criticism, it provokes fear. It makes us afraid to change. It makes us afraid of failure. And we know that the self-critical people, research shows that they may not even attempt a goal because the fear of failing. Whereas when you look at the research on self-compassion, it's really just the opposite. It increases self-efficacy. And the research shows that people that are self-compassionate, they actually adhere to exercise programs longer. They are more able to meet weight loss goals and other health behaviors. And we see that people that are self-compassionate, they are more intrinsically motivated. They set high standards for themselves. And this is important because a lot of times people think if I'm too easy on myself, if I'm not self-critical, if I'm self-compassionate, then I'll just eat bonbons all day. And that's not what we see. The research doesn't show that at all. It shows that, again, they set high standards for themselves and they aren't as upset if they don't reach the goal. And if they fail, they get back up. So unlike the self-critical person who just doesn't even try or quits, the self-compassionate person gets back on that horse and sets new goals, even after failing. And they don't ruminate about the failure as long as somebody that's self-critical. And so this is really, really important because what a nicer way to go through life. Instead of beating ourselves up, we are gentle and compassionate and like, good job, it's okay. You know, it works. And it's like I said, a much nicer way to go through life. So when we're looking at self-efficacy, one of the easy ways to build it is to put ourselves in situations that are the easiest at first. So I have a table coming up that'll show, like, here's the easiest. I can exercise if I put myself in this situation. If I put myself in this situation that's really hard, I'm probably not going to do it. So we want to set people up for success, so helping them to create some of these tables. So here's the table that I mentioned, and it's just ranking easiest to most difficult. So the situation is when I exercise in the morning and put my exercise clothes out the night before, that's when I'm most successful. It's fairly easy when I schedule short walks at work with my coworkers during breaks. Moderately becoming more difficult on weekends when I don't have a regular schedule. Getting difficult after work, when I'm hungry and tired, and then most difficult on Fridays when I go to happy hour. All motivation goes out the window after a couple drinks. So we want our clients to rate that difficulty and look at the situations and then put themselves in those easiest situations. As the self-efficacy starts to increase, then we start putting them in, or suggest. We want to work with them, obviously. We're not dictating, but gently put them into those more difficult situations. Here is the name of the other validated questionnaire that I was mentioning, the Weight Efficacy Life Scale. This is the WELL questionnaire. These are a couple different scales that you could use to assess self-efficacy. So these are, again, one that looks at diet self-efficacy, another looks at exercise self-efficacy. And what's great about these two is that they are public domain, so you don't have to get permission to use them. You're able to use them. There are some scales out there that if you're using and you're getting money, you have to pay them. You have to get permission, and you may have to pay. So these are okay to use. The other thing when we're looking at setting goals I wanted to mention is that it helps from a psychological perspective to set goals around the behaviors versus the result or the outcome. So a lot of times, what do people do when they set a health goal? I want to lose 10 pounds by November, or they probably won't even set November, but they'll say, I want to lose 10 pounds by, 2 weeks from now, or whatever it is. Hopefully not. And it helps instead of just using the outcome, because if, let's say our goal was 2 pounds a week of weight loss, and we don't meet that goal, people can become really frustrated and really disillusioned with the progress. And of course, a lot of people will quit if they don't see that specific goal met the way they wanted it met. Whereas if we focus on the behaviors that are going to get us to the ultimate goal of reducing that 10 pounds, for example, then we can feel proud of ourselves and increase the self-efficacy and feel some sense of security that we can do it. And I think that when we focus on the behavior, and not just me, I mean, research tells us this, that we can move people along and people are more likely to stick with it long enough to actually see those results and change those brain synapses. We want to change the brain. We got to get some deep roots in there. And if people are quitting too soon, they're obviously not going to create new connections within the brain. So if you're looking at maybe some of these, I've just got some examples. Let's say exercise here, of course, yoga 3 days per week, NEAT 5 times a day, 5 days a week, and walk the kids to school 3 days per week. So instead of just saying exercise more, which of course is a very general, we want to have something that's using those SMART goals, that it's specific, it's action-oriented. Wait, SMART, yes, action-oriented. No, I forgot the M. Measurable, specific, measurable, action-oriented, and it's realistic, and it's time-oriented. So obviously I don't have all those details in this. This is really just focusing on the result or the behavior, but we really want to set those SMART goals so that we can measure and we can really see if somebody's progressing. But this is a great goal. Okay, I want to exercise 3 days a week. If we can knock it down to which days are we going to do those yoga classes, and how are we going to engage in NEAT 5 days a week or 5 times a day? What are we going to do that just on the weekdays? Are we going to do anything on the weekends? Are we going to set an alarm on our phone, on our watch, and so on? So we want to try to make it as specific as we can. And the other thing that's so important is planning ahead. And really, this is targeting relapse and looking at obstacles. We can obviously look to our past and see what things have gotten us off track and plan for those things, because we know they're always going to happen again. We're always going to get sick. We're always going to get busy with work or school. There's always going to be something. Or like when you have kids, there's always a kid that gets sick. There's always something that's going on that can derail us from the program. So we want to plan for those as best we can and have something in place so when this happens, we are really prepared. We've really thought about it and what we're going to do to get back on track, and also to let go of the judgment and the self-critical nature that does nothing but provoke stress and actually make it worse and more difficult to get back on. And it increases our drives to overeat and to engage in unhealthy behaviors, whether it's smoking, drinking, whatever. So prepare. And if we set goals each week, okay, this is what I want to try to accomplish. This is what I want to do. What are the obstacles that might get in the way of that week's goal? And how can I improve and increase my chances of reaching success? And who can support me in that? And I would add to this is reward. What's the reward of meeting that goal? It could be something that's non-food or excessive. Could be a massage. I mean, maybe you wait until you do the exercise a little bit longer before you treat yourself to the massage. But maybe you treat yourself to the massage. Who knows? Whatever it is, you want to set up some rewards that you give yourself only when you reach those goals. It's like giving your kids a sticker on the board. I have like a lot of tasks for my kids, and I give them stickers. Sticker. It works. It works. And it works for us too. We just have to figure out what the rewards are that are going to reinforce that behavior. I'd like to spend just a little time talking about scope of practice. Obviously, many of us are coming from different fields, whether it's a dietitian or a psychologist or a fitness professional. We bring different things as health coaches, and we need to be cognizant of where to draw the line. For example, I'm not a psychotherapist, and so if I have a patient that is, has depression, and I've had people, I had a lady recently that had postpartum psychosis, and so I knew there were certain limits of what I could do for her, and I needed to make sure that she was still getting that professional psychotherapy that she needed, and to not do something that I was talking about within this group. It was a health education group, and that she needed to make sure, you know, if there was something that was going beyond what she was comfortable with, that she needed to talk to me about that, and we needed to make sure that she was safe, that she felt safe. So I think, you know, we need to make sure that we're referring people out when we need to. And so that's part of coming up with a network. I wanted to I'm actually just going to read part of this, but this is a statement, and it's talking about health coaches and nutrition counseling. If you're not a registered dietitian or certified nutrition specialist, and even certified nutrition specialists, certain states are not going to recognize that. So we have to look at our individual states where we are and look at some of the laws to practice or to even give nutrition advice. So currently, health coaches are not licensed in any states in the U.S. And if there is an exclusive scope of practice nutrition licensing law, and I've got some really great info for you to look at this, but you can see you'll see on the next slide, I believe it shows some red or orange on the map, and it kind of tells you where some of these states are that it's actually illegal for the health coach to provide nutrition counseling. So you have to really look at what state you're in. California, we have a little bit more leeway here, but you have to, I really recommend that you take a look at this site before you before you start counseling patients in nutrition if you're not a registered dietitian. So here's the website. It's nutritionadvocacy.org, and it's the Center for Nutrition Advocacy. So here you could see, as I was mentioning, there's different colors of states. And so for the red states, you can see that it is illegal to perform individualized nutrition counseling unless you're a licensed or exempt. Effectively, only RDs, registered dietitians, are eligible for licensure. So in most states, that's going to be the case. There are a few states where the certified nutrition specialist, that I have the certified nutrition specialist certification, and to sit for that exam, you have to have a master's degree or higher, and you have to have gosh, I can't even remember the hours, like 2,000 hours of actually working with patients or clients. But you still, some states are not going to recognize that. So you have to look at where you live to be able to give nutrition advice. So as I mentioned, there are some states that have a little bit more rigid or strict rules on this. So let's say for personal trainers, for example, if you're in one of those red states, then you are not allowed to use nutrition tools in your practice unless specifically named in the laws, list of exemptions. And if you look at some of the states, if you're actually hired by a physician that has a license that includes practice of nutrition. So in some of those cases, with this, if you're under their supervision and within their scope of practice guidelines, you might be able to practice. So you have to, again, really check with whomever is hiring you or you're hired by, and your state's guidelines. Thanks, everybody. See you next time.